We have a specific capacity to immunize in Ontario. We absolutely want those that are currently eligible to continue to come forward, so those that are over 70, and today we have over 20% have come forward and got their third dose boosters, and also First Nations, Inuit, Métis members of our community, those that are immune suppressed or transplant patients, and healthcare workers. We built capacity to ensure over the next 2 weeks that those individuals could come forward together with the 5 to 11-year-olds and be able to get their third doses. And this is a call to arms for those age groups. I really want the over 70s in particular to come forward, as we know they're most at risk for waning immunity, fading immunity, and a risk for transmission. In these next 10 days, if you get your booster, you'll be well protected for the holiday season, and children will get the maximum benefit being immunized in the next 10 days for the holiday season as well by getting their first doses. So to me, these next 10 days, we built capacity to ensure that those populations have opportunity to get immunized. We then built capacity for the next most vulnerable group, the over 60 and over 50s, on the 13th. We'll monitor the volume of individuals that come forward for their third doses, and the overall capacity of the system, which is over 100,000 right now, and yesterday we had 67,000 people immunized, so a real call to arms. If we don't see the capacity being used that we've built to best protect those staged and phased high priority groups, we will then potentially open it up sooner to other age groups, but we'll always be in consultation with our Ontario Immunization Advisory Committee. We'll always follow the best science and guidance, and I do believe we'll be hearing from our federal partners on their recommendations on boosters in the coming days as well, which will only further guide further boosters. I also want to assure Ontarians that we're monitoring the immune benefit at a population level from these vaccines, and at 8 months out. For the general population, so 50 and less, we are seeing ongoing good immunity, but we want to be able to provide the third doses in a timely fashion before the immunity fades, especially as we're seeing an increase in cases related to Delta and the potential threat of Omicron to our communities as well. So I hope you're seeing that it is evidence-based, it's staged and phased based on our capacity to immunize in Ontario, but we absolutely will be following the science and opening up third doses if the capacity isn't being used, and following best science.